Hi, my name's Cheryl. I'm going to be a student nurse helping take care of you today. I just need to do a quick head-to-toe assessment on you. Can you please verify your name and date of birth?
Ryan Vansquist, June 6, 1973.
Perfect. Do you have any allergies?
No.
I'll assess the patient's vitals, checking the blood pressure, temperature, pulse, respirations, and O2 sats, and document that. Ryan, do you know where you're at today?
The hospital?
And do you know why you're here?
Yeah, my right hip.
Okay, and do you know what day of the week it is?
Tuesday.
Okay, I'm going to, Ryan, are you experiencing any pain?
Yes.
Okay, where's the pain located?
Right hip.
Okay, and can you describe the pain?
It's a sharp pain. It radiates all the way around it. It goes down my leg.
Okay, so it does radiate. Does anything make the pain better or worse?
I just try not to move too much.
Okay, and have you tried anything to help alleviate the pain, such as medications?
Anti-inflammatories, Tylenol.
And does that work well for you?
It works okay.
Okay, and if you had to rate the pain from 0 to 10, how would you rate your pain?
Your floor.
Okay, and I'm going to start at the patient's head, checking any of the bony prominences for any skin breakdown behind the ears. Moving down, I'll look at the neck veins, make sure they're not descended, and check skin turgor. And Ryan, can you smile for me? Good. And then I'll look in the patient's mouth, checking the oral mucosa. Can you open your mouth for me? And making sure that it is moist and intact, and it is. I'm just going to shine my light in your eye, Ryan. All right. And can you follow my pen for me? Good. And do you wear any assistive devices, Ryan?
No.
Like hearing aids? Can you hear this?
Yes.
How about this? This?
Yes.
Okay. Do you wear glasses or dentures?
I wear glasses.
Okay. And then I'm going to move down the patient's arms, checking for any lumps, bumps, bruises, injuries, or any skin breakdown. I'll assess the patient's IV site, making sure there's no infection, infiltration, or extravasation. I'll make sure that the bandage is clean, dry, and intact, and verify that the fluids are flowing at the rate ordered. And then can you squeeze my fingers for me? Good. I'll check for cap refill bilaterally and the radial pulses bilaterally. Have you been experiencing any numbness or tingling in your hands?
No.
Okay. And then I'm going to, have you experienced any shortness of breath?
No.
Any chest pain?
No.
Okay, I'm just going to listen to your lungs. I'll listen to the patient's lungs at 6 points, making sure to not go too fast, asking him to take deep breaths, as to not hyperventilate the patient. And then I'm going to listen to the apical pulse for 1 full minute. All right, can you roll over for me, Ryan? I'm going to assess the patient's skin on their back, making sure there's no skin breakdown, paying attention to any bony prominences, especially, and then I will listen to the patient's lung sounds again at 6 fields. So 1, 2, 3, 4, 5, and 6. And I'll also assess the patient's rectum, making sure that the skin is clean, dry, and intact. There's no skin breakdown. You can roll back over now. I'll assess, and I'm going to wash my hands after I assess the patient's rectum, and then I will put on new gloves and assess the patient's abdomen, making sure that it's not distended and that the umbilicus is midline. And I will listen to the patient's bowel sounds in all 4 quadrants. So 1, 2, 3, 4. And when was your last bowel movement, Ryan?
This morning.
Did you experience any constipation or diarrhea?
No.
Any change in frequency?
No.
Okay, I'm just going to palpate. Tell me if you feel any tenderness. Okay. Then I will wash my hands, change my gloves, and I'm going to assess the patient's genitals, looking in the creases and folds for any skin breakdown. And Brian, when was your last void?
About an hour ago.
Any change in frequency or burning?
No.
Okay. I'm going to change my gloves again, and then moving down the patient's legs, I'll be checking for any lumps, bumps, bruises, any edema. And then, Ryan, can you pull up on my hands for me? And then press down. I'll check for cap refill bilaterally. I'm going to check the posterior tibial pulses bilaterally. the pedal pulses bilaterally. Ryan, have you had any numbness or tingling in your feet?
In my left foot.
Okay, and how long have you had that?
A couple of years.
Okay, well, make sure to let the doctor know. I'm going to assess the skin on the feet, making sure to check in between the toes and the heels for any skin breakdown. And Ryan, do you need any help repositioning in bed?
No.
And do you need any help ambulating to the bathroom right now?
No.
Do you use a walker, a cane, or a wheelchair?
No.
All right, I'm going to tidy the patient's room, give the patient their call light, document my findings, and leave the room. And perform hand hygiene.